Hey everyone, welcome back to the Natural Delights channel. I'm so glad you're here. You know how much I love sharing simple, natural ways to help you feel your best. And today, we're diving into a topic that's super important for men's health, prostate cancer. Now, I'm not here to diagnose anything. That's what your doctor is for. But what I do want to do is empower you with knowledge. We're going to talk about 10 warning signs of prostate cancer that you should never ignore. Remember, early detection is key when it comes to fighting any kind of cancer, and prostate cancer is no exception. So let's get right to it. Let's talk about the first warning sign: frequent urination. This is something that can really disrupt your life, especially if it happens often. Guys, if you're making more trips to the bathroom than usual, especially at night, it could be a sign of an enlarged prostate, also known as BPH, which is often benign. This condition is quite common as men get older, but it could also be a sign of something more serious like prostate cancer. It's important to be aware of these symptoms and not just brush them off. Think about it. Your prostate is right there, snuggled up next to your bladder. When it starts to grow, it can cause a lot of issues. When it gets enlarged, it can actually press on your bladder, making you feel like you have to pee all the time. This pressure can be quite uncomfortable and persistent. Now I know what you're thinking. I drink a lot of water. Maybe that's why I pee so much. Staying hydrated is important, but it might not be the only reason. And yeah, that's definitely a possibility. However, it's crucial to consider other factors as well. But if you're noticing a sudden increase in bathroom trips, or if you're waking up multiple times a night to go, it's worth getting checked out just to be safe. Don't ignore these signs. Your health is too important. Next up, we're talking about difficulty starting urination. This is a common issue that many people face but often feel embarrassed to discuss. This one's pretty self-explanatory. If you're straining to go, or if it takes a while for the flow to get going, that's a red flag. You might find yourself standing there, waiting for something to happen, but nothing does. Or maybe it takes a few moments before the stream starts. This delay can be frustrating and concerning. It's not just an inconvenience, it could be a sign of something more serious. Again, this could be due to an enlarged prostate, which can actually pinch off the urethra, making it harder for urine to pass through. The prostate gland surrounds the urethra, and when it enlarges, it can squeeze the urethra, restricting the flow. But it could also be a sign of prostate cancer. Early detection is crucial, so it's important to pay attention to these symptoms and seek medical advice. Think of it like this. Your urethra is like a garden hose, and your prostate is like a hand squeezing the hose. The more pressure applied, the harder it is for the water to flow. The tighter the squeeze, the harder it is for the water, or in this case, urine, to flow through. This analogy helps to understand why urination becomes difficult. So if you're noticing any hesitation or difficulty starting your stream, don't brush it off. Talk to your doctor. Early intervention can make a significant difference in managing the condition and improving your quality of life. Now, this next warning sign is a big one: blood in urine or semen. This is not something you want to ignore. Seeing blood in your urine, also known as hematuria, or in your semen, called hemospermia, is a serious symptom that requires immediate medical attention. Now, before you panic, it's important to remember that blood in the urine or semen doesn't automatically mean prostate cancer. It could be caused by other things, like a urinary tract infection, kidney stones, or even strenuous exercise. However, it's crucial to get it checked out by a doctor right away to determine the underlying cause. They can perform tests to figure out what's going on and recommend the appropriate treatment. Let's talk about warning sign number 5, painful or burning urination. This one's pretty uncomfortable, and it's a clear indication that something's not quite right. Pain or burning during urination, also known as dysuria, can be caused by a number of things, including urinary tract infections, sexually transmitted infections, or even an enlarged prostate. When it comes to prostate cancer, this symptom usually indicates that the cancer has spread beyond the prostate itself. So, if you're experiencing pain or burning when you pee, don't try to tough it out. Make an appointment with your doctor to get it checked out. Moving on to warning sign number 6, discomfort in the pelvic area. This one can be a little trickier to pinpoint because the pelvis is a pretty big area. We're talking about any kind of persistent pain, pressure, or discomfort in the area between your belly button and your hips. It might feel like a dull ache, a sharp pain, or even just a general feeling of fullness. If you're experiencing this type of discomfort, especially if it's accompanied by any of the other symptoms we've discussed, it's important to see your doctor. This next warning sign is particularly concerning bone pain. While it's not always a symptom of prostate cancer, it can be a sign that the cancer has spread to the bones. Prostate cancer cells have a tendency to metastasize or spread to other parts of the body, and the bones are a common site. If you're experiencing persistent bone pain, especially in your back, hips, or pelvis, it's crucial to see your doctor right away. They can order imaging tests, like a bone scan, to check for any abnormalities. Let's talk about a sensitive topic, erectile dysfunction. While it's often caused by other factors like stress, anxiety, or medication side effects, erectile dysfunction can also be a sign of prostate cancer. The prostate gland plays a role in sexual function, and when it's affected by cancer, it can lead to difficulty getting or maintaining an erection. If you're experiencing erectile dysfunction, it's important to talk to your doctor. They can help you determine the underlying cause and recommend appropriate treatment options. The next warning sign is painful ejaculation. This one's pretty straightforward. If you're experiencing pain or discomfort during ejaculation, it's not something you should ignore. Like erectile dysfunction, painful ejaculation can be caused by a number of factors, including inflammation, infection, or nerve damage. It can also be a sign of prostate cancer. If you're experiencing this symptom, don't hesitate to talk to your doctor. Last but not least, we have unexplained weight loss. Now, I'm not talking about intentionally shedding a few pounds for summer. I'm talking about losing weight without making any changes to your diet or exercise routine. Unexplained weight loss can be a sign of many different health conditions, including cancer. When cancer is present in the body, it can affect your metabolism and lead to weight loss. If you're noticing that your clothes are fitting looser or you're dropping pounds without trying, it's important to see your doctor to rule out any underlying medical conditions. So there you have it, 10 warning signs of prostate cancer you should never ignore. These signs can be subtle, but paying attention to them can make a significant difference in your health outcomes. Remember, Early detection is key when it comes to fighting this disease. If you're experiencing any of these symptoms, don't hesitate to talk to your doctor. Regular checkups and screenings can help catch issues early, making treatment more effective. And don't forget to subscribe to Natural Delights channel for more tips on natural remedies and healthy living. We cover a wide range of topics to help you stay informed and proactive about your health. Hit that notification bell so you never miss an upload. Staying updated with our latest videos ensures you have the most current information on maintaining a healthy lifestyle. Disclaimer: I am not a medical doctor. The information provided in this video is for educational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or proper nutritional advice. Never disregard professional medical advice or delay in seeking it because of something you have watched in this video. Your health is too important to take chances with. If you have any concerns about your health, it's always best to consult with a healthcare professional. They can provide personalized advice and treatment options tailored to your specific needs. Thank you for watching the Natural Delights channel. Your support means a lot to us, and we hope our content helps you lead a healthier life. Stay healthy and take care. Remember, a proactive approach to your health can lead to a happier, more fulfilling life.